Hello, everybody. My name is Nancy Forty. This is Megan Stewart, and we are both patient advocates because of our mutual chordoma experiences. And so this is going to be a little bit more of a casual presentation. We don't have a PowerPoint, so we're going to tell you briefly our stories and then what we decided for us was so important to share with you and about how to advocate for yourself. And then we can just have some open discussion after that. So 15 years ago in 2008, my husband was misdiagnosed, by the way, with a spinal tumor. And we were in Rhode Island and they did all of the surgery. They did an anterior, posterior surgery. And they said he's going to be, good to go. They did not identify what the tumor was and they kept dragging their feet. And something did not settle with me. I will say I am a nurse by profession. Don't know anything about any of these kind of diseases, but something just didn't set right. And the more questions I asked, the less that they could reveal about what was going on. And so I took to the computer, I researched on the internet, and I found this thing called chordoma. And in 2008, as you saw on Josh's graph, it was pretty flat. There was not much information. There were about 6 articles that the same 6 articles kept recirculating. But he checked every box on that profile. And so I brought it to the doctors. And this is up until 2.5 weeks after his surgeries, please look at this. And they said, no, we can figure it out. So they didn't figure it out. And at the end, they said that he had a tumor of unknown origin. And so that comes with it, a diagnosis of 3 to 6 months of life. So they really kind of wrote him off. They said, you're all set, go have a good summer, play golf, live your life. What I didn't know, and what we found our way to Boston. We finally got the right pathology after a harangue with those folks. They did go and test. He's positive for chordoma. We find our way here. They do the surgery again. And what happened was they really didn't think he would live. So they did not do a bone graft. They told me that they did. They just put in screws and rods, nothing, the wrong diameter screws. So all of that over time, probably 3 months would have just given way and he certainly would have died. But they just did not think that he would have any life. So I learned all of that in a big swirl that, when something is not settling right, yes, you do need to find your voice. And so I found my voice and it's very loud now. And I do question along the way because subsequently things happen. And we need to know, how does chordoma relate to other things that happen to us? And we're in a lovely setting today. We all know about chordoma because we're all experiencing it. But outside of the chordoma specialists, you're going to encounter other doctors that don't know what it is. And so that's where we think that we've devised some helpful tips to how do we communicate to other doctors what's wrong with us and how this impacts. Take it away, Megan.
Okay. Thanks, Nancy. I'm Megan Stewart. I am the spouse of a chordoma survivor. My husband was diagnosed in 2016 with sacral chordoma. We had a similar situation with being with folks that did not know anything about this disease, and in a lot of ways were going to be overconfident in the way they were handling it. And we had to kind of slow down. I know that was discussed during the expert panel about slowing down and getting information. And thankfully we did that. We ended up traveling to Johns Hopkins. Dr. Walensky, who's now at Northwestern, was my husband's neurosurgeon. And while it was challenging, we had a 5th grader and a 7th grader at the time to be a part as a family. It was crucial. And as the expert said, the first time around, and we talked about this, first time around is the best time around to handle it in the best manner. So he was up at Hopkins for almost a month, had a total resection. We opted not to do radiation, and just made that, which again, another thing that is a topic that people have a variety of thoughts on for lots of different reasons, case by case in a lot of ways. And talked to Dr. Walensky, talked to Dr. Leach, and it's one of those things where we'll hold that in our in our arsenal if we need it. So anyway, he's 7 years out September, and he, after a long recovery, returned to his regular activities, including going on camping trips with our son, who became an Eagle Scout, and all sorts of fun dad things. So I went back to school. I was consultant, and then I was home with my kids. I went back to school and did a program for patient advocacy, and I'm in the process now of launching a private practice in this. And when Nancy and I got together on the phone to discuss this, we said, well, what would be of value to our peers? And in a lot of ways, what we described it as is a toolkit. And I actually, hearing in the session before, they were referring to toolkits a lot. And I was like, okay, so we were on the right track with that buzzword. And we think that there's a way that even though every case is different, there is a standard way that you probably can be prepared in a lot better ways than we were. And we kind of had to muddle through it. And so what we came up with, we did not do slides, but we came up with this handout. As well as going on the Chordoma Foundation website, there are some amazing resources that Shannon and Andrea and the gang have all come up with that I think, and so does Nancy, should be part of your toolkit. So Nancy's going to start off, but looking at the one pager, and I would actually argue, I had helped my grandfather with some health issues, another friend with cancer. I think this toolkit concept applies across the board, frankly. Like, I mean, I think it's definitely, there's a Chordoma specific component to what we have here. There's these awesome handouts, but honestly, these handouts themselves also could be tailored to many different types of issues, be it with elder care or rare disease, chronic care, it all applies. So, I mean, I would encourage that this be something that, facing now, the post-COVID world we're all in, and healthcare as it is, that we do need to be our own advocates. Our families need to be their own advocates. We need to advocate for our loved ones. And there is kind of a way to go about it. So Nancy, do you want to start us off and kind of talk about the components that we think would be very helpful?
So on this one pager, one of the things that I've come across, so I do some health advocacy, private cases. And so when I ask people, tell me about yourself, tell me about your issue, and this is not even chordoma related, it could be any other kind of cancer. They start in the middle and they kind of go around, and it's very hard to get the facts of what exactly happened to them and what the current issue is. So for us especially, it's so important to be able to articulate that to anybody that you meet, that you're being cared for, including a primary care. So this toolkit, the first thing that we come up with is to develop kind of an elevator speech, a quick little story, 2-3 sentences that captures what happened to you. So I wrote this. This is actually my husband. My husband is still with us, but he's not here physically. He's 15 years out, and he does have some compromise. So sitting, standing, he can't do all of this. So at any rate, this is what I came up with for him. 15 years ago, I was diagnosed with a chordoma, which is a very rare primary bone tumor of the spine. I have undergone multiple surgeries, followed by proton beam radiation. Due to the aggressive treatment, I have significant and debilitating back pain, along with chronic kidney disease as a result of surgical trauma. So that kind of gives a little setting point for a physician to then ask other questions. Well, tell me about your kidney disease, or tell me about your pain and how that impacts. So I think that if you say it in a streamlined way, in a chronological order, it gives your provider a place to start from and to know to ask you the relevant questions, because they can't read your mind. They're in a hurry, always in a hurry, not to be rude, but they are just busy folks. So it's up to us to articulate in a very clear and concise manner, and in a short, in a minute or less, 2 minutes or less.
And that goes for if you're seeing a primary care doctor, if you're in the hospital for an emergency situation, a new specialist.
So for example, so my husband in 2021, I think it was unrelated. We're not sure that it was unrelated, but ends up in the emergency room. We think he had pneumonia. It turned out it was a hemorrhaging in both lungs. Don't know why. But for every specialist that came through, I had to repeat the story. Now, I wasn't prepared with exactly this concise. I should have been. So, but I had to go through the story every single time for every single specialist. And the other piece of information that I find is even they document in the chart, they write their progress notes, but guess what? They don't read the previous note. So again, you're the expert, and they're going to come to you again and ask, and if they might not, you need to know what's been done before and what questions to ask them. So you're the expert, your voice. So the things, the easy things, and this is, personal health information are, you should always have a list of your current medications because they're always going to ask you, and including your over-the-counter medications. You should always have that probably in a little card with you at all times. But we're suggesting that you have maybe a little folder at home that you keep everything handy just in case, or if you're going to visit another doctor. PCP and the specialist that you're seeing. So most everybody is seeing multiple doctors. And so we need a list of who is seeing so they can see, especially your PCP should know who else is in the game with you. Your past surgeries and again, in a concise way, past surgery, the year, what it was for, and the pathology results, most important, what did they find? And then any other general related issues or unrelated issues. With my husband, it was his kidney. So that is always, nobody ever asked about it. They see that he has abnormal lab work, but nobody asked. It's amazing. But it's real important in his care that they know why he has a kidney issue and what can be done and what can't be done. And before I turn it over to Megan, I'll say this, I will tell you this story. Not too long ago, he had one of his scans and it showed what it looked like on the MRI as kidney stones. And I wasn't with him at that appointment. So I'm the advocate, I'm the spokesperson. He's not good at this. He should be better trained, you would think. The urologist said, well, this is kidney stones. I want you to go to the desk and schedule a procedure. We're going to take you to the OR. We do this, it's a lithotripsy. They crush the stones. And he knew I wasn't there. He said, I've got to talk to my wife. And then the doctor backed off and she said, well, would you prefer a CAT scan first? And he said, yeah, that would be okay. A CAT scan, I don't need permission for it. Just say, okay. So lo and behold, he has a CAT scan and you know what? There were no kidney stones. And had I been there and had she asked, have you ever had any problems? She didn't. We would have known that he has an adhesion in his ureter and that has caused hydronephrosis in his kidney, urine to back up in his kidney. And it's longstanding. And you can see that his kidney is shapen now. But she didn't ask those questions and he wasn't prepared with the information. So, a save from doing a procedure that he didn't need. So important to talk about things related and even unrelated.
Yeah, absolutely. And I think, and this is why we said like either the notes app in your phone, if you're very much have an iPad, a phone, something you would have on you, totally fine. Have all your stuff there. That can be copied down. Whatever's going to be the easiest system for you. If it's a physical folder, then so be it. Like it's as long as it's, and that's the third bullet point, is that as long as it's readily accessible. So hard copies are great. Quicker, easy access through a patient portal. They're great too. The only issue that I know that we have found is that we're not on one portal, right? Like we're on this portal for this specialist and then they're in this portal. So in that sense, creating your own portal or having everything in one place is kind of what we're going for. I would say that the most important thing also is having those physical copies of the imaging. So before you leave your scan, you can say, I'd like 2 to 3 copies of these discs. Take those discs, you have them at home, and that will be obviously a hard copy of it in your folder. Then you go back and you get the report from the radiologist. And then I know in the case of my husband, we send off the report from the radiologist and the physical disc because Dr. Walensky, for example, wants to literally look at the images himself. So you're armed, right? So you can mail one off if need be, bring it and leave it at a doctor's office, whatever the situation may be, but you still have a copy or two for yourself. So that's an easy thing to sort of streamline and have your process as you do follow up testing, have that be your protocol for yourself, save you a couple steps. If you're trying to, better to start where you mean to finish on all of this. And you're not recreating the wheel in a year or two when someone says to you, what's going on? So that's that point. The other thing that's important, and this sounds obvious, but as time goes on, as you get into a group, just keep updating it. Just make sure that you're kind of looking every 6-12 months. You're saying, okay, what do I need to put back in here? Do I need to print something off from my visit? Because I think what we're learning and what we're trying to say is sometimes you have to be your own quarterback. In an ideal world, you'll have a primary care that can manage a lot of these pieces, but in a lot of cases, there isn't someone who is doing that. So you're going to be quarterbacking yourself.
So we have two. So Megan and I have spoken at length about this. She has a great PCP for her husband, who is a quarterback. I have a PCP who is a lovely man, but he disengages from Chordoma because he doesn't know it, he doesn't understand it. And so we have to constantly remind him that this is an issue. And then he kind of backs off from, oh, yeah, that's the most important thing. That's why. But so not all doctors are, created equal, get good care, I think, but again, it's on us, always to drive this big ship.
If you can find a good PCP, it's huge. And I know that's like really easier said than done, really a lot.
Atlanta and Rhode Island, so it's different. So
We just happen, he happens to be our friend too. So that was a lucky break. But he actually had a Chordoma patient. Did I tell you that? So our PCP of all the world had a Chordoma patient a year after. So, I know. He's like, how does lightning strike twice the same place? So he's probably more well-versed than most because of this. This is a fluke. But anyway, so, your medical history, you need to be informed and you need to be ready to inform others. The other issue, as we all know, is everyone working in silos, their subspecialties. And so, especially when we get into complicated cases where, urology and you're dealing with, neurosurgery, primary care, you may have other health issues, bringing that all together can be a challenge. The other thing is, Chordoma Foundation has a lot of great information on this on the website, but just being really prepared when you go to a doctor's appointment. Again, that sounds obvious, but if there's something going on, go ahead and write them down. Have a friend, have a husband, a wife, a sister, brother, whoever with you. If they can't be with you, have them on the phone. Like, it is so hard to digest all the information coming at you. And then be thinking on your feet, either be writing it down, thinking about it, but then also thinking of the follow-up question. So tag teaming major doctor's appointments, huge. And see, in the case of your husband, almost cost him a procedure. So,
Well, exactly. And so part of my experience in, the health advocacy side is being with patients, sometimes physically going to an appointment to be that second set of ears and be taking the notes, but often I am on the phone and participating in the visit, able to ask the doctor questions. And, the better the clinicians, the more they invite that kind of dialogue. First of all, it helps them so that the patient is, they're sure that the patient is going to, absorb this information and can process it. And then I would write notes after their visit and give them back and say, what questions do you have? So that's how I work with people, because 9 out of 10 times they miss something big. They miss a big thing, something that you might not want to hear, that you need to hear. So important always when you go again, just somebody on the phone, and even if it's just a family member that is not skilled in healthcare, but listening and can write and just, be a little bit more objective for you.
Yeah, absolutely. And
Nancy, can I ask a quick question? So as a patient advocate, I wasn't aware that you could be on a call with and then in the doctor's office. Would it also be allowed, if you do not have a patient advocate, to report that?
You can always record. You can always record.
do you have to tell the doctor? I would think
I
so.
would tell the doctor, and so a good physician would not mind. They don't mind. They want you to do that because they don't want to be repeating and they don't want calls afterwards. So they want you to get as much information a good, our specialists, like, they're amazing. None of them would have a problem with that. But, and I've never had a problem now, one time with, being on the phone with the doctor and stopping and say, excuse me, doctor, I have a question. And find, and, answers to my satisfaction so that I can report that. So, and it's always been helpful, and most of the patients that I deal with are usually in a crisis situation, in something like this, they don't know what's going on, they don't understand the diagnosis. And it's particularly important when you're in an emergency. We don't expect that, we don't plan for that.
I think COVID has helped some of that because people are so used to not being able to have visitors. So if you were to say, I'm calling someone, I don't think a doctor reacts probably in the way that maybe like 5-10 years ago. they would be
And I've been
surprised.
doing it a long time and
You were
they
ahead of the
react.
game.
I was ahead of the
You
game.
were a trendsetter.
But yes, probably not very so much as virtually now.
Yeah, so hopefully we shouldn't have an issue with it. I think the other thing is, and here's respectfully press for thorough and satisfactory answers until you feel comfortable. That probably should have been underlined and bolded, because ultimately it's that peace within yourself that you have gotten the information you need to make the best decision you have at that time. That is the goal. And your decision may look different from someone else's, and that is fine. But as long as you have that feeling within yourself and with consultation with your loved ones or whomever, that you're proceeding with this plan, be it whatever your choice is, that's the crucial thing. So respectfully, definitely a key thing. The idea of, when I say you catch more flies with honey than vinegar, right? And I think that asking those questions, though, you just can't be afraid, because it is you and your life. And I think most of us here know that or have experienced that already. The other thing that I wanted us to look at were these awesome tools that are existing on our Chordoma Foundation website. We did print them out. This is the basic one pager that you would take to anyone who may not be familiar with Chordoma. So
Dentists, physical therapists, family doctors, and they don't want to have anything to do with it. You don't want anything to do with them.
exactly.
Good points.
Thank you. And then the back a little bit more detail, but then this also is more of a detailed personal information. There is a space for current medications. It may not be big enough. I know family members, we would need a second sheet, but I think that there's definitely room there to have the basics, and having this on hand in your file, copies of it on your phone, whatever
I was
is your
just gonna say, put it
system.
on your phone, it's easy enough to just have your phone to refer to and talk to.
The time when something that's a really rare disease, most of the time, this information is helpful to that.
And they take it as such. Yeah.
Yeah. And if they're not interested, they're not going to be interested, so you don't want them, but that, that's usually helpful. And I'm also a nurse, so.
Yes. So do you have anything to share? Because I know you've been in this space.
Well, I will tell you that when my son first started with this, we saw an expert and down in Baltimore, and he was wonderful. And he said, take your time, do your research, come back and see me when you're ready for surgery. That same day, we went to another doctor in Philadelphia, and who said, I was scheduled, he did not examine, did not show us his MRIs. Okay. Red flags are ticking for me, but, and he said, I have you scheduled in 2 weeks. And we said, well, who would you recommend for a second opinion? And he said, if you're going to take time for second opinions, I probably can't finish until August. This is April.
Wow. Goodbye.
That's what we did. So, I mean, saw him from across the desk. We just saw a wonderful physical examination earlier that day. And we did not even let the door close behind us quick enough, so.
So if you experience something like that and a person is not engaged in your care and listening to you, know that this is not a place for me. And it happens more frequently.
Yeah, don't let them bully you.
Yeah, and I hate to say it happens more frequently than you might expect. I mean, not everybody is, wants to sit down and hear your story. And you find those people, you want to help them and help them. But it's very often on the fly, and which problem, and it's kind of a brush off, and they don't necessarily want to know about chordoma. So that's something that you have to kind of feel it in and not be shy and say, thank you very much. We'll go elsewhere. And I would think, be as bold as to say, I think that we'll go for a second.
I think if they speak to you like that the first time that you meet them, imagine if you have a complication. and
Oh, yeah.
you Chat to them, so. it's-
We're kind of. Yeah.
So have any of you had a chance to step forward and have you had these experiences where it's not gone comfortably with the doctor and that you've had to step forward and find your voice?
Well, I had to go to an orthopedist before I went to an oncologist. And the physician assistant told me, well, if it hurts, it's not cancer.
Oh.
Don't worry about it. And I said, well, can I have an MRI just to be sure? No, the insurance is not gonna pay for that. They don't cover MRI just to make you feel better about it. And I left there. I was happy on one hand because she was saying it's not cancer, don't worry about it. And on the other hand, I was frustrated because I wanted the treatment and they were saying, no, we can't do that. Can't do that. So yeah, but then they called me 3 days later and said, come and have an MRI done. And the next thing they told me was, I told them that my mother had this problem also, the chordoma. And that's when they said, go to see an oncologist right away. It's not orthopedics. But yeah, it was kind of weird to see that.
But you picked it up right. I mean, you knew that it was not correct when they approached you that way.
Yeah.
I've had, so I don't know, there's a cloud over me, so I've had multiple experiences like that, even in my own family. One was my brother, and he had nagging pain in his hip for multiple years, 5 years, and they did x-rays and they said, oh, you got a little bit of arthritis here and there. But he was really debilitated, had fractures, and went to see the same doctor, and he said, well, we'll do another x-ray, and he said, no, you gotta do something else for me, there's something wrong. And he got very, the orthopedic surgeon, kind of very miffed, and he said, all right, we'll order an MRI. And when the MRI results came back, he called my brother and he said, Frank, I'm sorry. You have probably metastatic cancer. Your pelvis is full of tumors. So here's where another advocate comes in because he's a big strapping guy. And I don't think that sounds right either. And we found ourselves at Mass General, and it's he had actually something called hairy cell leukemia. So it wasn't an orthopedic condition at all. But they were ready to say, oh, this is what you go ahead, get some chemo and off you go. But he pushed to get the imaging. The doc, otherwise he would just think, well, I got some arthritis, I gotta wait until it gets worse. So you gotta be vocal.
Yeah, yes, I guess, in my case, by the time that I got diagnosed, I mean, it was about 6 months after pain started and stuff like that. But then I've done a CT and doctors immediately saw that there's something suspected in the stoma and, sent me to all kinds of exams, the MRI and blood tests and all of this stuff. So they knew it's a chordoma. Okay, and immediately said, okay, you have chordoma. This is very cancer for it. And I'm from Israel, okay, 1 to 1 million, it's 10 cases a year in Israel. So out of the 10 cases, probably let's say 5 are sarcoma, like we said. These 5 cases spread between several hospitals.
Right, so no expertise, right?
But he immediately said, yeah, let's operate there. It's easy, we offer funds, cut all the things. Put it the other side.
It's that easy, right? It's that easy.
You go home and so understanding that this is real disease without knowing too much, really. So the first question that my wife asked, then okay, so how much experience do you have in operating chordoma? So this is where the doctor started to move uncomfortable on the chair. Say, well, you understand that we don't have much experience, but if you do the surgery, this is the best hospital to do it here in Israel.
Of course.
Well, and we moved between several, because we've got some, second opinion within Israel, initially. It was exactly the same thing. Yeah, we don't have the experience, but if you do it, this is the best place to do it. So we had to deal with these arguments with the doctor, so, yeah, come. We operate.
What did that make you feel like to do? You knew that was correct. You knew.
Oh, yeah, yeah,
You knew right
yeah,
away.
yeah, no, we understood that, you know, it's going to be irresponsible to give myself up to them. But eventually I skipped surgery altogether and I've done only a weekend. So it's, you know, it was kind of a pause to go through. So we knew that the experience is not there. Yeah, maybe the doctor would say, forget about the experience. We do the surgery, don't worry. And then to feel my own part.
Well, yeah, we had a similar situation in our hometown, and I think that with rare disease, that it's exciting. And it's like, oh, this is a chance to, you know, and I think that medical community gets very excited in a lot of ways. They're inquisitive and all this stuff. So it's like, this is our chance to have this case. And so in a lot of ways, I felt like my husband got a lot of attention because he was exciting, but then you had to suddenly put your filter on and say, what is this the attention I want? And is it from the right people? And so that's when you listen to your heart and you say, no, this isn't the right kind of attention, and, pivot accordingly. So, yeah.
So I think to circle back, so you made a very special choice for your treatment, and you researched and you right out of the gate, you advocated for yourself. But we were listening today, and so even with our specialist here, there is still not 100% consensus about how to treat. So, adjuvant therapy, neoadjuvant therapy, they're all over. Not all over the map, but they have some, dissenting opinions on that. And none of them are not correct. So what matters is that you do the right treatment for you, for your personal situation. So surgery might not be right for everybody. And you may go to two great specialists. I mean, the idea is that you're going to a specialist. You may go to two great specialists and you're listening and they have giving you different opinions. So, which do I fit, for my lifestyle, what I want to going long term, what matters to me, what matters most to me. And that's how you have to, it comes from within. It's not, doctor tell me what to do. It has to come with you. You really have to do some soul searching and choose the right treatment, because even within this very specific subspecialty, medical subspecialty, there's an array of opinions in there, therapies you can use.
And I'd say about that is, so not only with doctors and specialists, but also with your peers. Because by the time I made my decision, once I understood the surgery option is more or less what it is, and so that there is a radiation option, and it's a bit less what it is. But I started to think that this might be a better option for me. And then I was looking through the network of the connections and the Facebook group. I was looking for other patients with second chordoma that done radiation on. And I found one in Australia, one in Japan, one in Serbia, one in Israel, just for me. And I talked to them, and I told them, why you made this decision yourselves?
Right.
So when they get to me, how to make a decision for myself.
Yeah, that's
And use
terrific.
all the
Yeah.
resources at your hand, including your peers. I think that's the other thing, especially in the rare disease community, right?
Talk with the specialist, talk with the experts, also talk with
To the patient.
another patient that done whatever, surgery, radiation, both, whatever, hear from them, why I made their decision for themselves to have a better person.
Excellent.
Especially if it's a procedure too, because I think sometimes that gets glossed over, what the side effects are and whatnot, so. So do you
I'm
have-
going to follow up with what Nancy was saying, asking questions. And on the Cordoma site, there are questions that have been written up to give you suggestions for that discussion. And I think those are very helpful in making that decision.
I would be remiss if I didn't say the Cordoma Foundation is a game changer. Anybody that is resources. It's just amazing. I wish that 15 years ago that we had something, but we didn't, but just avail yourself to everything that they offer because this is like it's not like any other foundations. And I've been involved with other different kinds of cancers, organizations and nothing like this.
Yeah, it's been awesome. Yeah, Shannon, my conversations with Shannon completely changed the course.
So timing is everything, so you're in a good place.
Yeah. So, well, thank you all for being
Thank you.
here.